Alright, in this video we're going to go over chapter 4, and it's going to cover finding out what's wrong. And a lot of times as you're reading these chapters, you're going to see all these different acronyms, and it can get kind of confusing trying to remember them all. So I like to use the 3 C's. This isn't in your book, but I like to use the 3 C's. And the reason I like that is because it's going to cover your primary check, your secondary check, and your ability to activate the EMS system, which is call and care. So all the same stuff that's talked about in your book, the 3 C's cover it, and it's a lot easier to remember. So what I'm going to do on this video is I'm going to cover the 3 C's, and then I'll go back and talk about some of the acronyms used in your book to help you to remember what to do and show you how it's just a lot easier to remember. But just remember, for the quizzes and stuff, you'll be tested over what's in the book. But the 3 C's is definitely a lot more functional, because when you start off with the 3 C's, well, the first one is to check. So we're checking the scene just to make sure the scene's safe, and we're also checking the victim. So this would be like our primary check. What's referred to in your book as a primary check. Because a lot of times you don't have time to do your secondary check, especially if the victim is unresponsive. So that's exactly what we're checking for here. Is the victim responsive? Because if they're not responsive, we're automatically going to call. We're going to get EMS on its way as fast as possible. So we're looking to see if they're responsive, if there is a severe injury. So this could be something as like external bleeding. We're going to have to care for that right away. And that also gets us into care first situations, call first situations, which we'll talk about in a moment. So that's the first C. You're checking the scene, you're checking the victim, and mainly you're checking here to see if they're responsive or if they have a severe injury. Because if they are not responsive, you're going to go ahead and start doing a secondary check to kind of determine, well, you may not even have time to do a secondary check, because part of your primary check is to check for airway, breathing, circulation, all that good stuff. So you don't want to do that more than about 10 seconds. So when you're doing your check, let's just go back over this real quick before we get to the call. So we check the scene, and then we go up and check the victim. So we're going to physically touch the victim. So this is all part of our primary check. And we're going to reach out and touch them and tap them. So you would tap the victim because they may be unconscious, and by tapping them, it may bring them back around so that we can actually try to talk to them and see exactly what's going on. And then once you tap them, if they're unresponsive, then we're going to go ahead and call. So once we determine that there is a severe injury or they're unresponsive, we're going to go ahead and call. So we're going to call 911 and get care on its way as fast as possible. Now once we call, we may need to do what's called a secondary check before we start to care. So a secondary check, just to determine a little bit more of what's going on. So we can check for signs of life. So we're checking for signs of life. Can also look for like a medical alert bracelet. On our secondary check, your book lists a whole bunch of different steps. You may or may not have time to do those. It just all depends on what you find. But we're definitely going to check for signs of life no more than about 10 seconds, because every minute care's delay reduces their chance of survival. So we can't sit there and take too long checking for signs of life. So we're going to open the airway and check to see if they're breathing. We're going to lean down and get close to them so we can see if we can hear them breathing. We're going to look down at their chest to see if we can, so that's visually check to see if we can see if they're breathing. We're also going to try to feel if they're breathing. So we're going to lean down and see if we can feel them breathing, see if we can feel their air or their expiration on our cheek. So that's all part of the secondary check. And depending on what we find there, if we still find no signs of life, then we're going to begin care based on what we find. So that secondary check is going to really help us determine what kind of care we give. Now let's go back over this in sequence, because you've got to use a common sense approach even when you're using check call care, because there may be certain circumstances where you may have to immediately start giving care. So care first, let's talk about care first situations and call first situations. Care first situations tend to be respiratory in nature. So somebody choking, that's a care first situation. We don't have time to call. If somebody's around, you can tell them to call while you're giving care, but we don't have time to stop and give them care. External bleeding, so severe bleeding. Let me just write severe down here so that you know I'm talking about severe bleeding, not just a little cut on the finger. That's a care first situation. We've got to care before we do anything else. So if we don't, they're going to bleed out before we can probably even make the phone call. So we got to get control of bleeding. Now, call first situations tend to be cardiac in nature. And that's mainly because the care we give, CPR, is only delaying or it's just trying to give them more time. So with CPR, you're only pumping about a third of the normal blood flow around. And we'll talk about this later when we get to the CPR chapter. And so you're still only getting a limited amount of the oxygen around to the tissues. So even if you continue CPR, and if care doesn't arrive, like EMS doesn't arrive, their chances of survival aren't very good. So that would be a call first situation. Cardiac emergencies tend to be call first, because we want to get care on its way, and then we begin CPR. So let's go over check call care one more time. We're checking the scene, just make sure we're not going to become a victim. Plus it tells us kind of what happened. We're checking the victim, we're reaching down, tapping them to see if they're responsive or what type of severe injury. We're kind of scanning them as we do that. And depending on what we find there, if they're unresponsive, we're going to, or have a really severe injury, we're going to call 911 unless it's a care first situation. Then we would go ahead and give care. But if it's a call first situation where we think it's possibly cardiac in nature, then we can begin our secondary check just to make sure there's no signs of life. So we can look, listen, and feel for breathing, no more than 10 seconds. And we're going to lean over and listen. We're going to visually scan after we do the head tilt chin lift. We're going to do that for about 10 seconds. And then we would provide care based on what we find. So if there's no breathing and it's adult, we're going to begin CPR. So we'd start with 30 compressions. After 30 compressions, we'd give 2 rescue breaths, and we would repeat that until we're too exhausted to continue, or EMS arrives, or the scene becomes unsafe, or an AED arrives. Now, if it's a child and you begin CPR, and we'll talk about this again later on in other chapters, but you would do 5 cycles first before you call, because we don't know how long they've been out. And typically, children or infants, it tends to be a respiratory emergency that leads to a cardiac emergency. That's the reason we give care first in that situation. Whereas adults, when they're unresponsive, it tends to be cardiac in nature. So that's the main difference there. Now let's go down and let's talk a little bit about the acronyms that your book uses. They use RAP and CAB. And I just want to show you how this all fits in. You're checking for responsiveness, which is the same thing we did when we did our first check, so that would be the first C. Then you're activating 911. So that's the same thing we did when we called. So check, call. Then we're going to position them. So if they're over on their side, we need to roll them over on their back so we can get them in the proper position, and we'll talk about that later. Then we need to begin CPR. If they're unresponsive, oops, it should be CPR, PR, if they're unresponsive. or give them the type of care we should give based on what we find. After we give CPR, we're going to open the airway, head tilt, chin lift, and then we're going to give 2 rescue breaths. Oops, misspelled that. That should be an S. 2 rescue breaths. So you can see this fits right in the 3 C's. So we're checking, we're calling, and then all of these are part of giving care. So that still fits in with the 3 C's. So I just wanted to make sure that you were aware that what I was telling you isn't any different. It just simplifies it. And like I said in previous videos, if you can simplify these skills, they're easier to think about. So that's the reason I like check, call, care. Let's go back to the secondary check. You know, we talked about this. There's also using a sample history, and here's another one of those great acronyms. Sometimes I feel that, yeah, acronyms are great, but if you overuse them, it will overwhelm somebody and they can't remember what they stand for. So don't get bogged down in all these. These are great if you can remember them, but don't go crazy trying to memorize all of these different acronyms. Check, call, care will help you out. It's probably the easiest one. The other ones, yeah, you're going to have to remember them for a quiz and for a test, but you know, in everyday use, be real careful trying to remember too many acronyms, because like I said, it can overwhelm you. So when you do a sample history, this is part of your secondary check. What you're looking for are symptoms, and this is just to help you, you know, especially if you're in contact with 911 or just trying to find out what's going on, or even when EMS arrives, you can give them more information. Allergies, so we're trying to find out, do they have any allergies? Some of this, if they're unresponsive, they're not going to be able to tell you this. You can visually see some symptoms. Maybe they look all swollen or something, or you see a sting site. Maybe they got stung by a bee. You might be able to find a little medical alert bracelet that will alert you to allergies and medications. And then you have past medical. Again, that should be on a medical alert bracelet. And then you have the last thing they ate. Now, of course, that's not going to be on a medical alert bracelet, but if they're aware and you can talk to them. Last oral intake, that's important. And events that led up to the injury. So that's what sample history means. Just good to remember. But, you know, I always go by who, what, when, where, sometimes even why it happened. I listed these in the other lecture, and this helps me out. It's just easy for me to remember. And as long as I'm asking those things, typically I'll cover and get enough of the information. Now, your sample history is useful, especially if the person's responsive. And if they're responsive during your secondary check, it may not be just as simple as checking for signs of life. Of course, you're going to do that. But if they're responsive, it can be more extensive, where you do a head to toe. So you're starting with the head, going to the eyes, and so forth, and you just go down the body. There's a whole list, the order that you should go in your book. If it's a young child, I don't know if they list this in your book. You want to go from toe to head. Mainly because they may be less willing to talk to you. If you start at their head, you may kind of freak them out. So if you go from toe to head, it's a little less scary for a young child. So that's always good to do. So you start with their toe and kind of play a little game with them and see if they can follow along. That's always real good. So I hope this was useful on trying to find out what's wrong. So check, call, care is good to know. Don't get overwhelmed with all the acronyms, and I'll see you in the next video.